Well, I was wondering if they were gonna, why they closed the medical services for like physical therapy or acupuncture or CMTs that work with seizure patients or chiropractors. All that's open is the main hospitals and none of the pain management people.
Sure.
So are they going to open up?
Yeah, it's a great question. A large part of that was due to fears that our hospitals could be overwhelmed by the crisis, and that we certainly didn't want to early on infect our healthcare workers. But there's, right now we're seeing across the UP, our hospitals are sustaining the current epidemic numbers very well. And so hopefully, I hope after the next couple of weeks, if we continue to see good trends, holding steady or even diminishing like it is in other areas of the state, that we might be the governor might be bringing those services back online. Mike, are you still on the line? Mike, can you hear me?
Well, most of those services are outside the hospital bounds. They're in private offices or clinics. So I don't get why they can't run their clinic. It's not a tap.
Yeah. Well, Kate, can you give us any additional input or insight on to how that decision was made or why?
So right off the top, I think it's really that face-to-face contact that they were looking to stem early, and at first it was thought to be symptomatic patients that would spread the disease, that would have severe symptoms. So not all places such as a physical therapy unit or just normal regular doctor's offices and clinics, not all of them have the appropriate PPE. So the recommended PPE for COVID-19 or to take care of a patient with COVID-19 is an N95 respirator. And those are usually in limited supply, and you don't usually see them at a normal clinic situation or in especially like a physical therapy situation. So the risk of exposure to the healthcare worker or the spread of the disease to other individuals that might be there at the clinic with you was higher at the time when this all first started. I hope that helps.
Thanks, Kate.